Clinical trials play a big role in our medical decision-making. And simply put, you need to be represented for us to make a good decision based on your particular cancer and how it works in your body. Now, I'm going to break down some other reasons why you should participate in clinical trials. For one, you get the first access to drugs, which are not available in the general population as yet. When you're on clinical trials, you're actually more likely to get frequent health checkups just because you need to be closely monitored while you're on the trial. It is an opportunity for you to make a difference and help other patients gain from the information that we learn on clinical trials and hopefully be able to do better with treatment of lung cancer in the future. One of the hidden benefits of being on clinical trials is actually costs. The reason for that is that the clinical drug is usually provided for free by the drug companies, and patients have access to things like stipends for transportation and help with the cost of their healthcare while they're on trial. So with every good thing, it does come with risks. Some of the risks of being on clinical trial is, well, we're on trial because we don't know everything. We're trying to assess how the drug works, if it does work, or if there are any side effects. So because we do not know those answers as yet, there is a risk of side effects, and there is a risk that the treatment may not work for you. The most common fear that I've heard from patients is that they don't get the treatment when they're on trial. Now, clinical trials today are not like they were before, with the concept of what a placebo drug is. Now, when clinical trials are designed, there's the trial drug, and then there's a standard of care. The concept of there being a sugar pill or you're being given something that we know doesn't work as well isn't actually done today. At the very least, the concept of placebo is the standard of care for medications that are available in the general population today. The final thing that can be from clinical trials that some people may see, as a concern is that it can be inconvenient. You're probably going to need more frequent checkups. You're going to need more frequent scans, and that is part of your time. So clinical trials are always an option. It may not be the first option or the second option, but it is always considered an option. So even if you're not confident right now about going into a clinical trial and you're comfortable with your treatment right now, there's no harm in asking your physician. There's no harm of seeing what your options are. As a patient, it's better to know all your options than have some hidden. I am part of a minority community, obviously. My parents are, all my family are, I have many friends. I would make the same recommendation to them as I'm making to you. Clinical trials are how we know how to do better for you as a patient and how we know to do better for others in the future. I encourage you as my patient the same way I would encourage my family. Please ask for all your options. Please open yourself to the idea of what a clinical trial will be like, and at least make sure that you get all the information so that you can make an informed decision.